thinking about sort of your own journey, and you've come so far in terms of, like you mentioned over 20 years ago, what advice would you have for maybe younger women who are diagnosed with ovarian cancer, which sometimes we think of as a cancer for older women, but we do know that some of the more rare subtypes of ovarian cancer can actually occur during the reproductive health age, right? Are there any things that you think of that you would like to share, or things that you felt like were really important to you in terms of being, either getting support or other advice that you may have?
I would definitely say to go for the support, being able to talk to others who are either survivors or recently went through something similar, possibly had the same treatments as you or the same surgeries. I think now I do it as I'm older, but I think of what a difference it would have done when I was younger. And the other biggest part is to really pay attention to your own body, listen to your body. Don't hold back in asking questions, whether it's, because we think that we're menstruating and it's that time of the month, if we're constipated, if we're bloated, if we're, all of a sudden lactose intolerant, or at least we start diagnosing things, not thinking that it can be something else. So it's, ovarian cancer is hard since it has a lot of the same symptoms that we normally go through at that age during menstruation. But really it's listening to your body. If something doesn't feel right or look right, just stay adamant on asking for help, asking for another doctor, asking for it to be seen is probably my biggest advice, and using those resources out there.
I think that's fantastic advice to any woman, and to remember that that's equally applicable to younger women, who maybe even a little bit more, unfortunately, discounted, because people often think of this as being something that we need to worry about for older patients. And so that's really, I really loved how you, articulated that for our audience as well. So.